Merci, Monsieur.
Thank you, Mr. Speaker. My question is to the Minister of Health and Long-Term Care.
Providers at the Owen Sound Family Health Organization and the Port Arthur Health Centre in Thunder Bay have been on strike for weeks. In 2 different communities, in 2 different family health clinics, patients lost access to their primary care providers because these workers cannot continue to put up with the toxic working condition that undermine their ability to provide good care. Low pay, precarious contract, favoritism, bullying, and extremely high turnover. Minister, on behalf of the patient of Owen Sound and Thunder Bay, how can they count on quality care when their primary health care providers face these working conditions?
Minister.
Thank you to the member for the question. Patient care and safety, of course, is a primary concern for all of us. I am aware of the situation in both Thunder Bay and Owen Sound. I think it's reflective of the situation that's grown up over 15 years of Liberal neglect and mismanagement, but we are going to try and fix that. Having said that, this particular situation in these 2 locations is a private discussion between the operators of the clinics and the support staff. So I am very hopeful that they will be able to reach a decision soon. I'm very confident of the bargaining process that they've entered into. We are following it closely, but it is a private matter between those 2 organizations.
Supplementary question.
Speaker, at the Port Arthur Health Centre in Thunder Bay, there are lifelong employees. We're talking somebody who's worked there for 30 years and makes less than $15 an hour. In Owen Sound, the talks have broken off because the owners want to lay off their nurses. These are healthcare professionals. They shouldn't have to be on strike to protect public health care, to stop nursing cuts, and to demand respect and dignity on the job. What will this government do to help these frontline healthcare workers and to ensure that people, not profit, comes first in our healthcare system?
As the member will know, the ministry is not a party to these negotiations. This is a private matter between the clinics and their employees. We know that there is a great settlement dispute resolution that happens in Ontario. We are hopeful that they will be able to come to a conclusion very soon. We cannot interfere in that process. That is not appropriate for us to do that. We are monitoring the situation because patient care and safety is, of course, of paramount concern to us.
Thank you.